Greetings. I'm Father Bob Yezel, and I'm retired from Holy Cross Church in DeWitt and also from the Diocese of Syracuse. I'm very excited to welcome you to our new website, especially in light of COVID. So many of us have been hit by that terrible, terrible pandemic. I spent 7 months in hospitals and rehabs. Perhaps you or your loved one has as well. And so today we're finding a new way to come to you, and that's by the website. I pray that this brings you great peace, consolation, and new spiritual insights. During the past year and a half, Father Cliff Auth and Katie Tovar have certainly been running a wonderful program. Father Cliff is from St. Augustine's in Baldwinsville and St. Mary's in Baldwinsville. Katie Tovar, you know, is a standard person at the CARE program. She keeps us together. She's the backbone of the organization. I'm so grateful to both of those wonderful people for keeping the program going and helping us to come to you now via the website. I pray that as we have new speakers and we have some new topics, we can have some new insights. And I'm sure that's going to happen as we come out of the cocoons we've all been in and move on in life. And so we're excited about having you get excited with us and be a part of our community as well. So thank you for being with us today, and thank you for all that you do, and thank you for your prayers. God bless you, and you have a great day.
Good afternoon. My name's Patrick Van Beveren. I'm a physical therapist and have been for the last 50 years. I've been involved with treating people with Parkinson's disease exclusively for about the last 5 years. And I'm presently functioning as the executive director of a 501c3 not-for-profit called Empower Parkinson's. What is Parkinson's disease? It is a progressive neurodegenerative disease. It's essentially caused by a deficiency of dopamine, which is a neurotransmitter found in the brain. It is asymmetric. It doesn't affect the limbs equally, upper or lower. And it is a multi-system disease. It has no known cause and no known cure. I want that to sink in for a little bit. A progressive neurodegenerative disease. The nervous system degenerates over time. And that's where the multi-system disease comes from. The nervous system affects every single system in the body. So that Parkinson's disease, which is often thought of as just a motor problem, is actually a multi-system problem and leads to multi-system failure in people. So you can imagine with a diagnosis of Parkinson's disease, how you view your future life. And in a nutshell, no matter how bad you feel today, it's pretty much going to be the best day of the rest of your life. The course of Parkinson's disease. It is a long disease, and it's extremely variable. How people progress, what symptoms they have, are really completely unpredictable. Oftentimes, people start to have symptoms way prior to when they're diagnosed, as many as 20 years prior to diagnosis. And interestingly enough, it is almost universal, despite the variability of the disease, that people first complain of constipation and loss of smell, which can precede the diagnosis by about 20 years. People also complain of sleep disturbances. At the time of the diagnosis, many people are complaining of some motor problem. They may have some tremor, but again, almost consistently, they have some shuffling of one side of their body. So they'll drag a right or a left foot, and they'll lose swing of their arm during gait. The typical age of onset is somewhere in people's 60s, but it's as early as 30, or you can be diagnosed into your 80s. Anyone who's diagnosed prior to the age of 50 is considered young onset Parkinson's disease, and that probably accounts for about 10% of the Parkinson's population. And again, it's a very unpredictable course in terms of the deterioration of the nervous system that does occur. And we'll talk specifically about symptoms, but people lose motor control at different rates. Their loss of function is different, how much tremor they get, the rigidity, any kind of dysfunction with their speech, or any cognitive changes. It's very variable and unpredictable. People typically say about Parkinson's disease, if you know a person with Parkinson's disease, you know one person with Parkinson's disease. There's also no lab test that diagnoses Parkinson's disease. It is a clinical diagnosis. And again, there have been some recent tests that look at how much dopamine is present in the brain. It's called a DTS scan, though that's not used very extensively. For the most part, it is based on how the person's history and how that person presents at the time when they see the physician who makes that diagnosis. And again, I want to draw your attention to the gravity of the diagnosis of Parkinson's. Typically, the physician will tell you you have Parkinson's disease, which is a neurodegenerative disease, that he can treat you with medication, but the medication loses its effectiveness over time and, in fact, causes other symptoms, side effects, like dyskinesia, and, that there is no known cure. All I can tell you at this time is to stay active and exercise. So I think you can put yourself in that position of hearing that diagnosis and getting a sense of the isolation that you feel and the depression that you have, based on what your future looks like at that time. Particularly so if you really have no working knowledge of Parkinson's disease. Who gets Parkinson's disease? Again, it's not predictable at all. As I mentioned, it's typically in the 60s. There is more prevalence in men compared to women, 60 to 40. But overall, even though the numbers are small, 1 to 2 million people in the United States and probably about 10 million people worldwide have Parkinson's disease. And that number appears to be increasing at a steeper rate recently. Since the 60s, it's been fairly flat, but in the last 10 years, the rate of progression has increased significantly. In central New York, there's somewhere between 3,000 and 3,500 people who are afflicted with Parkinson's disease, and about 100 to 150 who are diagnosed annually. Obviously, a good thing that the numbers are relatively small, but on the other side, because the numbers are small, sometimes enough attention is not paid to those people who have Parkinson's disease. What are the key components of management of Parkinson's disease? Certainly education, trying to understand the disease the best you can is very helpful. And getting that information wherever you come. Obviously, the most popular place right now is on the internet, probably the preferred places with professionals and other people who are dealing with that disease. The standard of care from a medication standpoint is the use of dopamine agonists, which is levodopa, carbidopa. As I mentioned, dopamine is the lack of dopamine is the primary cause of the disease. So obviously giving a person dopamine helps that person. There are also chemicals in the brain which rid the brain of dopamine as it's used. So another medication is a medication that depresses those types of cells. People develop tremors with Parkinson's, and there is an intervention surgery called deep brain stimulation, where they actually plant electrodes in the brain. The part of the brain is called the substantia nigra. And that has become fairly sophisticated. The electrodes that are implanted now have multiple sites where they can stimulate the brain, and they can change intensity and which sites they're stimulating to try to get the best result to decrease tremor in people. That's how deep brain stimulation is primarily used. Exercise and activity is really a cornerstone of the treatment, and has been shown in the literature to delay the progression of the disease and really has no bad side effects. Reducing stress is helpful, which includes mindfulness and deep breathing. Nutrition is important, and there are actual diets for people with Parkinson's disease. And socialization also causes the release of dopamine. Socialization, laughter, conversation, the sense of feeling good is a stimulus for dopamine to be released in the brain. Bottom line is, you really need a team to help you with the management of your Parkinson's disease. There is a subspecialty of neurology called movement disorder specialists, MDSs, who really lead the team, but rehab specialists, physical therapists, occupational therapists, speech therapists are all helpful. Care partner, someone to help you along with that journey, a support group. Exchanging information with people who are going through the same thing is tremendously helpful. And, decreasing that feeling of isolation and depression. Behavior or personal training, especially group exercise. Group exercise, you get a big bang for your buck. You're able to do the exercise and activity, plus you're able to interact, socialize, and compare notes with other people who have Parkinson's disease. Mental health specialists are helpful in managing the changes in your life that you have to deal with. And case managers, in terms of your needs from a social medical standpoint, and as the disease progresses, how that's going to be managed. Parkinson's disease does affect the central nervous system, and what we see from that is motor symptoms, which includes tremors. Again, they're asymmetric. They can occur in the hands, the arms, the legs, the jaw, and the face. A cardinal sign of Parkinson is bradykinesia, which is slowness of motion, and some people progress to rigidity with stiffness both in the lower and the upper extremity and in the arms. And there's a phenomenon called freezing, where people who are attempting to walk or move their arms actually get stuck and cannot move, and the more anxious they become, the harder it is to move. Again, one of the symptoms that is kind of a bizarre symptom of the disease, probably occurring in about 10 to 20% of people. And then because of the loss of motor control, there is postural instability. These are all the typical motor symptoms. That's of the central nervous system, but I said it was a neurodegenerative disease, so the autonomic nervous system is also affected. And autonomic nervous system are all those things that you do not think of that cause us to function normally. So heart rate, respiration rate, opening and closing of blood vessels. And so some of the associated non-motor symptoms are mood disorders. Obviously, the brain is part of that neurological system, and depression is probably that dominant mood disorder. There are cognitive changes. People's ability to maintain their attention, to multitask, to plan and to sequence becomes disrupted. And then there are visual spatial disturbances that have very significant functional implications. One of the biggest being driving, and just recently I had two patients, one who went right down along the side of the guardrail, who thought she was in the middle of the road because she had difficulty with that spatial, visual orientation. And then other autonomic nervous system findings include bowel and bladder dysfunction, blood pressure, sexual dysfunction. Sleep is often affected with apnea, and then daytime fatigue and daytime sleepiness. And in the periphery, there are sensory disturbances, people getting tingling, burning, pain sensations. So it all goes back to the first slide where I talk about it being this neurodegenerative disease. The whole of the nervous system is affected, right from the brain, through the spinal cord, through the periphery, both the central nervous system and the autonomic nervous system. And if you look at the literature, there's a wealth of information that says that if you stay on top of your disease, if you try to check all of the boxes from the last slide in terms of knowing about the disease, being active, using your medication, decreasing the stress in your life the best you can, paying attention to your nutrition, having your team in place, that you can stay functional for a significantly longer period of time than those people who are not managing their disease and just becoming depressed over it, despair over it, and don't move forward trying to help themselves. As I mentioned, activity and exercise is a huge component of maintaining function. Activity is a broad category. Everything is activity. Exercise is one form of activity. And what distinguishes exercise is that it has particular goals. And the goals, obviously, with Parkinson's disease are to address all of those motor symptoms that do occur. A physician will tell someone to exercise, but all exercise is not created equal. There are criteria for effective exercise. The first one is intensity. You really have to exercise at a level that you're not used to exercising at least 60% of your maximum capacity to achieve results. When people do exercise, you need to ask them, was that difficult? Was that hard? If they say it's easy, it's probably not very effective. They have to use the word hard in their exercise program so that you know the intensity is at an adequate level that they're going to see some improvement. The second criteria is specificity, which means the exercise has to address the deficit. Now, with Parkinson's disease, it's not hard to be specific because of the expansive loss that people face. So we use a boxing program to address functional loss in people. Because if you think about boxing, it is the ultimate fitness exercise. You have to be strong, you have to be powerful, you have to be coordinated, you have to have good balance, you have to have hand-eye coordination. All of those things are the things that Parkinson is trying to steal away from people. So the exercise matches the deficit. There's other exercise activity that we offer, such as yoga. And yoga is known for, flexibility. So you're going to increase the flexibility in that person, and that's the specificity of yoga. But you may not address some of the other problems that people with Parkinson's have. Tai Chi addresses balance, dance, balance, coordination. But it does turn out that boxing meets most of the needs of the deficits that people with Parkinson's have. And the last one that for criteria for effective exercise, especially for people with neurological disease, is novelty. The more novel the exercise is, things that they're not used to doing, it seems to be more effective, especially within that neurological system. And boxing kind of does that also. The strategy, the footwork, the stance, the punches you throw, the combinations, moving the body is all novel for people. So that is an example of very specific exercise that is effective for people with Parkinson's. Empower Parkinson's originally started as Rocksteady Boxing, and then we progressed to becoming a 501c3 with the mission to keep people as functional for as long as possible. And we went to the literature and saw what the literature said about that, and have tried since that time to offer all of those programs that the literature says is effective in people with Parkinson's.
Empower Parkinson's. Our mission is to provide a holistic program of wellness and prevention, empowering people with Parkinson's disease to fight back, to maintain their functional abilities, and to age well.
We were faced with an unprecedented challenge last March when COVID came about. But we immediately, from the time we left the gym, it was literally 4 days before we started Zoom classes. We did our typical activities, which included the boxing, and we do a program called Big and Loud. We did balancing classes on Zoom. We did some educational webinars. But one of the things that we realized immediately was the pandemic was going to create isolation. And that really is a huge difficulty for people with Parkinson's, leading to depression. So whereas we were doing 3 support groups a month, we switched to doing 3 support groups a week. We were just getting together on Zoom to address the social needs of our population. When we merged into springtime, summer, and the CDC said that we could go outside and exercise, we immediately moved into the park. We went to Onondaga Lake Park, we did polling in the park, and we started an exercise program that was just a combination of everything from Zumba to boxing. I think we created quite a spectacle. Besides us doing the exercise, we had a gallery of people who would come by to watch to see what we did. We were able to return to the gym in September. We were following all the CDC guidelines of taking temperature, using disinfectant, and using hand sanitizers. And I think we really did very well. We had 2 near misses. 2 people in our boxing group did get COVID, but it was isolated to them. We did not pass it to anyone else. Finally, with this year and the advent of the vaccination, we have seen more and more people who are interested in our program and more of our former boxers returning to the gym. We're also able to add another evidence-based program called Pedaling for Parkinson's. It's a program that came out of the Cleveland Clinic that has shown at least 30% improvement for people who participate. And then just I give you some percentage of people who are participating. 30% of our former people are back. We're offering 50% of our programs, but we're looking at the future with 100% enthusiasm to returning to everything that we did in the past. We've also began a partnership with the Davis Phinney Foundation, who is a foundation started by Davis Phinney, a former Olympic bicyclist, who is intent on helping people with Parkinson's disease to live well. There's actually 4 major foundations. Michael J. Fox, which is intent upon a cure and has spent billions of dollars really looking for a cure and is making advancement. There's the American Parkinson's Disease Association, which is intent upon training professionals to do a better job. And there's the Parkinson's Foundation, who really tries to help patients do research for a cure, train professionals, really do all things for all people. But the Davis Phinney Foundation approached us about becoming a healthy Parkinson community, one of 15 in a pilot study. And we recently formed a committee to explore the needs of people with Parkinson's, our community, and move towards strategies to address those needs. I wanted to just touch on the role of hope. It's interesting with the Rock Steady program, their motto is hope in our corner. And I really think that they got that 100% right. The socialization, the exercise, the camaraderie changes people's perspective about their disease. I'm always impressed with people coming in to watch our boxers box, people with Parkinson's, and their first comment is, all those people have Parkinson's? Because they can't believe the interaction that they have, the laughter that occurs with our boxing. And I really do think that group exercise is tremendously effective in replacing the isolation and despair with hope. And I think this has been around for a long time, since Frankel's book, Viktor Frankel's Man's Search for Meaning in 1959, where, you know, he was a psychiatrist who was actually in the Nazi prison camps and identified people who were successful at getting through the camps. And the thing that they had in common was hope and a reason to live for the future. And I think that that is what boxing, with exercise, with the community of Parkinson's, gives a person with Parkinson's, and why our program is effective. And there's no doubt that the literature has clearly established a relationship between spiritual well-being and hope and people who do well with chronic diseases. And that pretty much sums it up. That's where Mary Ann comes in to talk about spirituality.
Thank you, Pat, for the transition to talking a little bit here about spirituality and Parkinson's disease. Everybody has a different definition for Parkinson's disease, or for spirituality today. Merriam-Webster says it's something that's related to a faith or a church or a clerical situation. And by the time you get to the fourth definition they give us, it's the quality or state of being spiritual, which to me is a circular definition. You're using the word to define the word. There are some people who think it is only about religion, and a specific religion at that. And they relate it to God or powers that created life in the universe. But there are many people who actually see this as a more modern definition of psychic powers or paranormal activity that goes on that's not physical. Pat mentioned meditation or mindfulness, and that can be a key part for people with Parkinson's disease, but it's also a key that people think about in relation to their spirituality. Some people use yoga or other Buddhist religions to look at their spirituality, but definitely today people are looking at it beyond the concept of a specific religion or a specific faith. So what is spirituality to you? What do you see in this picture of a bright sunrise coming up in the morning? Do you have a spiritual experience when that happens to you on a daily basis? Or is your spirituality related to a faith community, to reading scripture? Or is it tied to nature, to the things you see in nature? As we approach the end of summer and fall here in central New York, we're about to see winter descend on us. But if you can take the time to look at nature in its beauty, that can make a difference too. In addition, some people think of spirituality as being present in the arts, in quiet time, as I mentioned and Pat mentioned, in yoga. Again, what is it to you? For some people, their spiritual experience happens when they're with their friends or with their family or connected to other people they love. The big question here today is spirituality important in managing Parkinson's disease? I've stolen one of Pat's slides here to run through how one manages Parkinson's disease. And I've cut it up a little bit for my own purposes. So Pat talked about addressing depression and struggling with acceptance. He talked about exercise and activity and stress reduction, nutrition. One of the things that I'm interested in talking to you about is taking the time to evaluate your life and where you are right now when you're diagnosed with Parkinson's disease. As Pat talked about earlier, you can see it and its progression and where it's going. But can you also stop and see what are the positive things that are happening? What are the things you can look forward to and not get yourself caught up in the depression and the progression of the disease alone? Pat also mentioned support groups and the importance of sharing your experience if you're managing Parkinson's disease with other people who are also experiencing it. Care partners also need to look for support. They should practice mindfulness, take a care partner course, join a support group themselves, and exercise regularly. And it's important to make time to relax. And if you notice, I'm underlining that word, make time. Not find time, but make sure that you set aside time to rest and relax as a caregiver, because it's a stressful situation. Also, eat a balanced diet and a healthy diet, as Pat talked about. This is an important part of Parkinson's, not just for the person with the disease, but also their caregiver. Care partners also need to take time to get away, to spend time not caring. You'll always be caring, but the actual hands-on care time, be sure you find time for respite and maintain your spirituality, whether you're a person living with Parkinson's disease or a person caring for someone with Parkinson's today. So today I'm going to ask each of you to do one little exercise for now and for the next week. Look for 3 good things. Write down the 3 things, and if your hand shakes and you can't write anymore, ask your care partner to help you with this. But write down 3 good things that are happening. What was good about those good things? How did you feel about them? And if you find yourself focusing on the negatives that are related to Parkinson's disease, try to look back at these records of what were the good things? What are the good things? Maybe the good thing is that you spent time boxing today and you got to be with other people who are also experiencing it. Maybe another good thing is you got to hug your grandkids today. Think about 3 good things which will make a difference in how you look at yourself and what's happening with the disease. Pat gave you some resources, and I am too. I didn't mention the American Parkinson's because they're more focused on professionals. But for all of you who are dealing with Parkinson's every day, whether you're the person with Parkinson's or you're the care partner, look at these different websites: Davis Phinney Foundation, Michael J. Fox Foundation, the Parkinson's Foundation. There's all kinds of information about the disease and about caregiving. This website that I find quite interesting is the Greater Good in Action. At Berkeley in California, they have a whole department that just focuses on kindness, goodness, and how it makes a difference in how we feel on a daily basis. Parker Palmer talks about aging in general, but gives us some clues of how we can do it gracefully and well. And for those of you who do follow a spiritual or a religious faith, Christianity or Judaism, there's a great book by Peter Wolf called May I Hate God, because when you're first facing this diagnosis and you're a person of faith, you may be feeling as if, where is God? What is God doing to me? Etc. It's okay to be angry, but it's also okay to move beyond it. And your spirituality can help you do that. I like this poem, and I wanted to share it with you before we close today. This is a sunset, or the day ending, and I want to be sure I've got it in front of me so I read it right. Mary Oliver's a favorite poet of mine, and she writes, "Be still, my soul, and steadfast. Earth and heaven, both are still watching, though time is draining from the clock, and your walk that was once confident and quick has become slow. So be slow if you must, but let the heart still play its true part. Love still as once you loved, deeply and without patience. Let God and the world know you are grateful that the gift has been given. So just face gratitude. Even though things are difficult, if you can continue to look at the gifts that are in your life, it can make all the difference in the world.
Hey there, my name is Chris Spilka and I'm the director here at Christ the King Retreat House in Syracuse. And I want to thank the CARE program for coming here. They're a tremendous organization. We are excited to host them. Since 1944, we have a tremendous legacy that actually began with the Jesuits over at Lemoyne College, if you can believe it. They began this beautiful tradition here at the Retreat House that carries on to today. In 1994, the Diocese of Syracuse purchased this place for $1 whole. It's the best bargain, I think, in the history of mankind. And since then, we have served as a refuge for many and assisted in their spiritual development. Maybe you are an individual that is really struggling despair and really feeling downtrodden these days. If you're feeling that way, this is a place that is perfect for you. We have many conference spaces and rooms that you can sit, relax, and refocus in a beautifully renovated chapel that you can come pray and talk to the Lord and let these different burdens off your heart. Maybe you're a group leader that is just looking to refocus and recalibrate the mission of your organization. If that is you, then we have 2 beautiful conference spaces in our Merton room and Loyola room that's perfect for the size of any group. If you are interested in coming here to Christ the King Retreat House, I invite you to check out our inquiry link on our website, ctkretreat.com. You can click on the inquiry there and you'll be connected with me, and we will book your retreat, whatever it may be. I look forward to speaking with you, and I hope that you'll join our beautiful tradition here and be a part of our history at Christ the King Retreat House. God bless you.